everybody, I am keeping this vlog for myself and maybe we'll post to YouTube at some point, but I've just made the decision to have bariatric surgery and I'm kind of freaking out a little bit, but I'm also excited, which seems to be the emotion that I'm finding on all my vlogs that I'm trying to follow and look up. But I see stress breakage here, man, which is probably why, I don't know, I may filter the crap out of this if I can before posting. But for those of you who don't know, I think I posted this channel, I don't even know, 2017 maybe, because I was so excited. I was starting on this Saxenda injection that was supposed to just make me lose all my weight. And I lost about 30 pounds, 20, 30 pounds, something like that. And then it stopped working and I stopped losing and I got discouraged and went back to my normal way of eating and quit doing the Saxenda, and of course the weight came back. So then I tried the ketogenic diet and I was on that for a year, maybe 8 months, something like that. Lost 0 weight. Now I will say, eating the keto diet, no zits, none. My body definitely, this is from sugar and carbs, 100%. But even though I felt great, no weight was coming off, 0 pounds lost. So quit doing that, and just kind of went back to a normal way of eating. Then it is the end of April now, February, I think, I started Weight Watchers. I'm like, Weight Watchers, let's go. Now, Weight Watchers was working. I did lose about 15 pounds, I think, before the quarantine hit. So I can't know for sure that I would have stalled out, but just given the history, since I've been trying to lose weight since I was in my 20s and I'm 40 now, it would have happened. It probably would have happened. So let me back up just a little bit. My husband's overweight. And he was just diagnosed last year as a type 2 diabetic. And when we were at the doctor's office last fall, fall of 2019, our doctor suggested bariatric surgery for him. And so of course I am like research queen. So I went home and I immediately started pulling up all these vlogs and information. And all I kept thinking was, I want to do this. I want this for me. And still looking at it for him, but in the back of my mind thinking, yeah, definitely want to do that. And then I saw one video where this woman showed her loose skin afterwards. And I thought, no, I can't do that. Like, I'd rather be fat, right? Like, I don't want to deal with this skin. And so I kind of just put it on the back burner and I was like, nah, never mind, not going to do it. So then my husband came to me, or was talking to me one day, this is just recently, I would say maybe in the past month, and he's like, I think I need to have the surgery. I'm just not going to be able to do it on my own. I need some help. He's like, I always lose the same 20. You know how that is because the same with you. Then it all comes back plus 10 more. And I was like, okay, I will 100% support you. So because we're all quarantined right now, we did a virtual doctor's appointment and the doctor was 100%, yes, that's great. Let's move forward. So that night I was thinking, because I went right back into serious research mode and was looking up everything. And I was like, you know what? I'm going to do it too. We'll do it together. Because honestly, that is not guaranteeing, but definitely going to improve our chances of success if we're both eating the same way. So we're not going to have the surgery at the exact same time because we have 4 children, but within like 4 to 6 weeks of each other. So I emailed my doctor, the secretary, and I said, is doctor on board with me doing the surgery too and doing it with my husband? And she wrote back the next day, yes, the doctor thinks that's a great idea. I do suffer from high blood pressure, and it's weight induced because I never had an issue until I was pregnant with my last child, in which I put on a lot of weight. Never had an issue with it before. So I guess it could be age induced too, but I'm still hoping that it's weight induced and that once the weight comes off, I can quit medicating for it. But anyway, I digress. So we called, the doctor's office for the surgery center called my husband. And so I called them and said, hey, my doctor said, he wants me to, go through this too. And so she's like, right now with everything going on, we actually have this telehealth thing where we can do your consultation over the phone. And instead of like a 4-hour doctor visit, it's a 1 hour on the phone. And I'm like, yeah. She's like, that way we can get this process started sooner. Now, all the research that I had done said 6 months to a year before you can get the surgery done. A lot of people said, yeah, we had to do a 6-month supervised diet. We had to lose, this many pounds before we could even get the surgery. And so I'm thinking, okay, well, even though it's, the end of April, we're not going to have the surgery till next year. Even a man my husband works with said, yeah, it was a year for him. So I'm talking to her and I said, I just wanted to ask you real quick, because I've been hearing varying things. Is it, 6 months to a year before surgery happens? And she's like, no. She's like, not with your insurance and not with this place. I said, well, I read, that some places had like a 6-month, supervised diet. She's like, nope. She's like, it could happen within 3 months. I was like, okay. So it kind of made it like super real. So I'm still in research mode right now. Our phone consultation is May 12th, 2020. So if I post this, tonight, it's April 22nd, maybe. I don't know. I can't keep anybody else not being able to keep the day straight during this quarantine. Like you wake up and you're like, what day is it? I don't know. But May 12th is our phone call. And hopefully after that, things will just kind of fly and we can get the show on the road. So I'm technology savvy for the most part, but not when it comes to making YouTube videos. So I'm going to be learning as I go on, hopefully getting better about interjecting pictures and things like that, because I want to show you, I took the embarrassing pictures, I've taken them, that, the sports bra and the pants that show what all I got going on. And so I will probably, after the phone consultation and I get a better grasp as far as timeline of when the surgery is going to happen and all that stuff, then I'll do a video posting the pictures. You can tell, with my face, I'm kind of a little chubby. But you can't really tell until you see the whole picture. So I'll probably update more in a video, maybe when I've had makeup, my hair done. I don't know. We'll see. But I just wanted to get this out there. So yeah, subscribe. Follow me, because I'm going to need you. If you've been through VSG, which is what I'm going to be going for, the vertical gastric sleeve. Vertical gastric sleeve. My husband probably will be doing the Roux-en-Y. So either one, if you've gone through it, thinking about going through it, know somebody who's going through it, or just want to be an encouragement to somebody, please subscribe. And yeah, go on this journey with me. I'm so excited and freaking out at the same time. So thanks, and I will see you all soon. So I just rewatched my video that I just made, and I realized I didn't touch on 2 things. One is, how did I get over the fear of loose skin? So real quick, I wanted to touch on that. I didn't get over it. I basically gently told my husband, if I am one of those people that winds up with a bunch of loose skin that cannot be hidden, Spanx ain't gonna help it kind of thing, that he needs to be supportive of plastic surgery. And he said, okay. So I don't know if that will be me. You know, I have seen so many pictures where some people, like, they don't have it, like maybe on their belly, maybe a little bit on their arms. And then you have other people who definitely have a lot of sagging extra skin. So I guess I won't know till afterwards. But at least knowing that he's on board with that, like, even if it's there, like, okay, we can get it taken care of. And the second thing is, if you were an original subscriber to this channel when it was the Saxenda turned weight loss journey, it kind of gives you a clue how I came to this conclusion, because some of you have followed my journey for 2 years now, almost 3. I think this June it'll be 3 years, and I'm still fat. So you know what I mean? Like, I think people who are gonna have this surgery, they just get to a point where they say enough. Like, I don't want to wake up 10 years older and still be struggling with knee pain and back pain and headaches and having this weight on me. You know, I've got a 15-year-old, 13-year-old, 11-year-old, and 8-year-old. And, you know, they want to go outside and play with me. And I'm like, I'll be there in a minute. You know, like, what kind of life is that? Like, I feel like I've already missed so much time with my oldest that I don't want that for me. So yeah, so if you've been with me since the beginning and you're like, okay, here she goes again, exactly, because I've had enough and this is it. Like, this is it. This surgery, it's going to give me the best possible chance to lose this weight once and for all. And I know the biggest plus from all the vlogs that I've been following is having a good support team. And lots of vloggers say their YouTube followers have been their biggest inspiration to keep going, to make the changes needed. So if you're just stumbling on this, please help me out. And if you're one of the original Saxenda followers from 3 years ago, hang with me, please. Like, just, I want you to see the change in me that I've been desiring to make for so long. So, okay, this is really goodbye. If I can find out how to edit the first goodbye out, but I'm just saying, I probably won't. So this is the real goodbye. Until next time. Bye.